This educational module provides a comprehensive overview of the field of physiotherapy. Our primary objective is to define its role within healthcare, outline its core principles, and detail its application across various patient populations. Understanding physiotherapy is crucial for appreciating its impact on functional restoration, pain management, and the enhancement of overall quality of life. Physiotherapy, also known as physical therapy, is a science-based healthcare profession dedicated to evaluating, restoring, and maintaining physical function and mobility. It is not just about recovery, it is about the scientific application of movement to ensure the body operates at its peak efficiency while preventing future physical decline or long-term disability. The profession operates on the principle of treating the whole person, considering their lifestyle and specific needs. Practitioners or physiotherapists are highly trained professionals who utilize in-depth knowledge of human anatomy, physiology, and biomechanics to diagnose and treat movement disorders, ensuring that every intervention is grounded in biological reality and evidence. The practice is founded on a systematic process, beginning with a thorough patient assessment. This critical first step includes analyzing movement patterns to identify imbalances and testing muscle strength to find areas of weakness. By observing how a patient moves in real time, the therapist can pinpoint the root cause of physical dysfunction. In addition to movement analysis, therapists perform detailed testing of joint range of motion and evaluate the patient's posture. These measurements provide a baseline for progress. This data-driven approach ensures that the therapist understands the physical limitations of the patient before any manual or exercise-based interventions are actually introduced or performed. Based on this comprehensive assessment, a tailored treatment plan is developed specifically for the individual. This plan is never one size fits all. It may incorporate several core modalities depending on the diagnosis. The goal is to create a strategic pathway that leads the patient from their current state of limitation toward full recovery. Manual therapy is a key modality involving hands-on techniques such as joint mobilization and soft tissue manipulation. These specialized movements are designed to reduce pain, improve circulation, and restore mobility to restricted joints. By physically manipulating the body's tissues, physiotherapists can often achieve immediate improvements in a patient's comfort and movement range. Therapeutic exercise is a cornerstone of the field, with specific routines prescribed to improve strength, flexibility, balance, and endurance. These exercises are carefully selected to challenge the body safely, allowing tissues to adapt and grow stronger over time. Consistent exercise is often the most effective way to ensure long-term functional improvement. Additionally, patient education is a critical component of the process. By teaching individuals about their condition and how to move correctly, therapists empower them with strategies for self-management and injury prevention. This educational aspect ensures that the benefits of therapy continue long after the patient has left the clinical setting. The scope of physiotherapy is extensive, addressing a wide array of conditions. In orthopedics, it is essential for rehabilitating musculoskeletal injuries like sprains, fractures, and chronic back pain. Whether recovering from surgery or a sports injury, orthopedic physiotherapy focuses on returning the musculoskeletal system to its full strength and functional capacity. In the field of neurology, physiotherapy aids patients recovering from stroke or managing long-term conditions like Parkinson's disease. The focus here is on neuroplasticity and retraining the nervous system to improve coordination and balance. This specialized care is vital for helping patients regain independence in their daily activities and basic movements. Cardiorespiratory physiotherapy assists individuals with conditions like asthma or those recovering from major cardiac surgery. Therapists use specific techniques to improve breathing efficiency and physical endurance. By optimizing the function of the heart and lungs, this branch of physiotherapy helps patients return to active lives without the burden of respiratory distress. The field also extends to specialized areas such as pediatrics, supporting children with developmental delays to reach their physical milestones. Conversely, in geriatrics, the focus shifts to falls prevention and maintaining mobility in older adults. These specialized applications ensure that physiotherapy provides valuable support to individuals at every single stage of the human life cycle. In summary, physiotherapy is a dynamic and essential discipline focused on optimizing human movement and function. Through a structured process of assessment, diagnosis, and evidence-based intervention, it addresses a broad spectrum of health conditions. The ultimate goal is to restore function, manage pain, and empower individuals to achieve their highest level of independence.